Hi everyone, my name is Jasmina Alajic and I'm an accounts manager here at Erchonia EMEA. Thank you for joining us on this enlightening webinar, Strategies for Stubborn Fat Loss with Dr. Brandon Brock. For those of you who don't know Dr. Brandon is a multi-licensed practitioner in Dallas, Texas, who holds a doctorate in family nursing practice from Duke University and a doctorate in chiropractic from Parker University. He has a diploma in functional neurology from an American Chiropractic Neurology Board and a nutrition diploma. He has extensive education in childhood disorders, electrodiagnostic medicine, and neurochemistry, and is a global clinical research scholar from Harvard Medical School, specializing in severe design and secondary analysis. Dr. Brock takes on tough cases from a family medicine perspective and enjoys integrative and interdisciplinary medicine for hormonal and autoimmune disorders. He works at Carpathia Collaborative in Dallas, Texas, is a clinical educator for functional neurology seminars and B2B health systems, brain chat, functional medicine meetings, and Dr. Brock seminars. He serves on the scientific advisory board for Hymogen Nutrition and SNA Technologies. Well, if I missed something, Dr. Brandon, you can correct me there. So we will be happy to assist you in the end of the webinar, which for your reference will be recorded and sent out to all attendees. I would like to alert you to the question and answer box on the right-hand side of the screen, which you can type your question to Dr. Brandon as we go, but we will be addressing this question at the end of the webinar. So just please type them in as we go along. Without further ado, over to you, Dr. Brandon. Oh, I can't hear you. I think you're muted. Might be some technical problem here. I think we have the problem with audio.
Can you hear me now?
Yes, I can hear you now.
Okay, thank you very much. Sorry, it just switched to a different microphone. Okay, well, sorry about the little snafu, folks. They usually get worked out. So appreciate everybody being here today. I'm going to really discuss some of the things that we go through clinically in regards to laser-based fat loss and the benefits of it. And then when you get some of those really stubborn or stuck patients, or some of the things that you can actually do to facilitate the whole process. And really, we've been turning laser-based fat loss, and in particular emerald-based technology, or the green wavelength, the 532. We've been using it successfully for weight loss for several years now, and have gotten great results. But there's always those things that you kind of learn along the way that you want to share with some people, so that if they're not getting the results that they want, or if they want to really escalate an entire program, there's some things that are behind that, and that's kind of what I want to share for you today. And really, I want to go through this and talk about just the 5 factors that I feel like are a big deal, because, you know, we only have an hour to go through this, and there really is a lot of extra little information that we could go through, but I think we can get down to the point and go through these 5 things and then show you kind of how we put together our program and give you some ideas. And I'll be more than happy to try to answer some questions at the end and go through that and leave a little bit of time and not hurry through this, and give you a lot of the theoretical aspects of why we're doing what we're doing. So anyway, without any further ado, this is just the introduction that I had. No big deal there. You guys already heard that. If anybody needs to kind of get a hold of me or see anything clinically, then I put a little QR code in the bottom corner there, and I believe the notes are going to be available. All right, so here's these 5 factors. So I was sitting around and I was thinking, like, what are the things that we've learned to adapt into our Emerald program? What have we started to look at? What are some of the things that we realized maybe put a barrier between our goals and between, you know, what we're actually seeing? And just remember that when the studies were done on Emerald technology and green light, it went through an American FDA clearance without any of these 5 factors being addressed. So I'm not giving you these factors to say that you have to do this in order for the laser to work. What we're trying to do is identify anything in an organism. An organism, human, is really a complex thing. It's really difficult to say that one thing is going to have the exact same results on everybody, and we're trying to target those individuals that don't get the typical results. And we notice that as society gets a little bit sicker, it's really important that we start addressing these things. So I like to kind of draw on the screen a little bit here. So one of the things that we always really kind of consider is hormone imbalances. And I'm going to show you a slide here in a minute that will show you things to look for on your patients when you're doing your evaluation that might suggest they have a certain body type that is accumulating more fat tissue or adipose tissue, and what it looks like on that patient. Is it around their waist? Is it on their back? Is it on their arms, under their armpits, around their neck, and so forth? So interestingly, if you don't have the fancier labs, or you don't have the ability to do those, you can kind of start learning to look at some of your patients. So I want to try to give you different levels of care. Some people love to get into labs, some people don't. Some people love to get into nutrition, and some people just like to look at food. So I'm going to give it to you at varying levels and give you just some common sense things that go a long way. And I'm even going to talk about integrating some of the other wavelengths in here, including violet and red. And there's some interesting stuff I'll show you on that. So, but we got to look at things like hypothyroidism. If somebody has untreated hypothyroidism, this really can be a difficult journey when you're looking at just using laser, because they have an untreated disease condition or a disease state. And, you know, just to identify these people, they're losing the lateral third of their brow, they're gaining weight, they're getting constipation, they're cold, their hair may be falling out and things like that. Sometimes they have swelling on the front of their neck. And I'll show you some other fat pattern distributions for these individuals. I would say the biggest culprit, the biggest barrier to anything working is insulin resistance. And so one of the things that happens is it's a very complicated mechanism, but as people start to eat more and move less, they really start to accumulate. They have the same amount of glucose in their bloodstream, and their body's trying to process it. So they'll start creating more insulin, and through several complicated mechanisms, the cell gets less sensitive to insulin. And so insulin starts to go up, and insulin is interesting because it creates inflammation, which causes water retention and pain and stuff like that. It also makes your triglycerides go up, so you can start getting dyslipidemia, which can lead to heart disease and stuff like that. It can change aldosterone, so your blood pressure starts to spike and go up. And then it can also make your good cholesterol go down, your bad cholesterol go up. And it can also make your platelets stickier, so you're at a higher risk for heart attack and things like that. But insulin resistance takes a fat cell and it basically locks its contents into place. And it's very, very difficult to reduce the size of adipocytes, which is fat cells, okay? So insulin resistance is a really, really big one. I'm going to show you some pretty cool stuff to monitor it, and then talk about some things to deal with it, because I would say if there's anything that's a deal breaker into people not responding, insulin resistance is a big one, okay? The next one is leptin resistance, and I'll go through leptin resistance as well. The other thing is stress. I will tell you, you have to be able to get sleep and you have to lower stress if you want to see the best results and that are, in regards to an entire Emerald protocol. And so sitting patients down, and then when you talk to them, kind of figuring out how much stress are you under, are you getting enough sleep, are you hydrated enough, and so forth. There's some basic things that I'm going to give you without making this too complicated, okay? But cortisol will also lock in fat cells. So insulin will lock in fat cells to where they don't release their internal contents as well through an adipopore. Cortisol and stress will do the same thing. Hypothyroidism will just slow down your metabolism per se. So the results that you may be seeing, they just may be slower because the metabolism is so unbelievably slow, okay? And then, we have a lot of other things in regards to hormones, and I'm going to talk about estrogen some. And really, as women are going through menopause and their estrogen starts to fluctuate, what can that do in regards to the overall ability to lose fat, or, are they going to hang on to fat? And we know that when estrogen gets skewed and that starts to drop postmenopausally, that it makes it more difficult for fat cells to relinquish their internal contents. And we know that you can see the little picture of the laser here opening up a pore, and it allows the internal contents to come out. And with Emerald, with 532, with the actual output that we're using in regards to the laser, it doesn't destroy or get rid of the fat cell. It just changes its ability to release its internal contents. And I'll show you some interesting stuff about that in a second, but we have to be able to do that. And so anything that can block that mechanism or make it to where these are more resilient to light, it becomes somewhat of a barrier, okay? We know the light does this, but are there some things that are going to impede that process, okay? And I think it's fair to say that there's always going to be something that's going to impede a process of something that's being done therapeutically. It's just the way a complex body goes. So look, poor sleep is going to affect the hormones that lock things in place. So, we always say at least 7 hours. So if you're sleeping less than 7 hours, it's not enough. If you're sleeping more than 9, it's too much, okay? Some people say 8's the magic number, but it varies in there for individuals. It really also regulates just how hungry people are. And I'll talk about tying that into a couple of other hormones like leptins, okay? So far, just to kind of let you know, we have insulin, cortisol, and leptins and estrogens. That's what we're going to be talking about in regards to hormones. And I'll throw a few other things in there, thyroid being one of them as well, okay? Again, chronic stress triggers the release of cortisol, and cortisol locks things into that cell. So again, think about those things. That's why whenever we're talking to people, it's like, how much are you sleeping? If you can't help them, then you may not be able to anticipate the same results. If they're under a lot of stress, you may not be able to have the same results. Some people get stressed and they binge eat. Some people don't eat at all. It can give various things. We could really go crazy on nutrition here, but some of the things that I see, key nutrients, if they're vitamin D deficient, it makes it more difficult for the process, okay? Magnesium, and then omega-3 fatty acids. One of the things that we like to use is a pretty high dose of those. And there's various versions out. The pro-resolving mediators is kind of what we're using because they decrease inflammation so well. And some of you may have a question about where you get those and what's the difference between an omega-3 and a pro-resolving mediator, or what we call SPMs, okay? Now, I put an interesting section in here on gut health. Now, we all know that if somebody has a bad gut, then they can get inflamed. But one of the things I want to say is that we know there are certain portions of your microbiome, all the different, bacteria that is in your gut. There's certain species or certain strains that we can actually give people, and it will help facilitate weight loss. So it's really interesting. Sometimes a little gut health goes a long way. Sometimes a little sleep goes a long way. Sometimes reducing your stress, meditating, relaxing, walking, doing whatever, and then getting your hormones checked, and then knowing the age and what they're predisposed to, and then determining if they're insulin resistant. Well, I really think that's kind of the backbone of a lot of the reasons why people don't respond. So these are just 5 factors. I don't know how many that you've noticed or that you're taking note of in your own clinical practice, but when we start to combine these things with Emerald, and if we address everything, very, very, very seldomly do we not get significant benefit results. And we're not using fancy peptides on top of those patients and stuff like that. They respond well. part of our overall health management of a lot of different conditions, we do use peptides, and I would love to talk about those at another time, and they do help things. But even without those, things that some of those medications that people are using for weight loss, when we address these factors and use Emerald the right way, we see great results. So as we kind of move on here, hormones. So you heard me talk about those of the big five. So again, I'm just trying to give you 5 things to think about here. You know how to use the laser, you know how to aim it, you know the time is set, it's very easy to use, and it is effective. Everything's been shown in the research that we're going in the right direction. But of the 5 factors that I was talking about, I put hormones as the first thing. And the reason why I put these things as hormones, and I'm including insulin and cortisol and leptins, I'm including all of these in the hormone category. These all have to be addressed, because if you do address these and you do help them even a little bit, it goes a long way in regards to results, okay? So if somebody's diabetic, you obviously need to look and see if they're on any medication, but before somebody becomes diabetic, typically their insulin goes up. And so I'm going to show you fat cells and what insulin does here in a minute. It does some really interesting things. It makes it very difficult to burn fat or empty its contents. It actually promotes fat storage. So sometimes what we're seeing here with insulin resistance, if this is a fat cell and we shine a laser on it and it empties its contents, when there's insulin resistance, it's hard for the fat that comes out or the triglycerides to be mobilized, because a fibrotic network gets made around these individual fat cells, and it kind of traps it in and it gets reabsorbed within 48 to 72 hours. So we see a transient fluctuation in size, okay? So that's one of those things that can be a bit tricky, and I'll show you some other stuff that you can do manually to help these patients out. So we have to look at insulin and insulin resistance. Typically anywhere from 2, 3, 4, maybe up to 10 years before somebody becomes diabetic, their insulin will go up. Very few people measure it, but if you measure insulin, I'm going to show you a lab panel here in a little bit. If you measure insulin and if it is a problem, there's some things that you can do that help this. One of them is just simple berberine and maybe going on a paleo diet. There's some simple things that you can do that will help with insulin resistance, depending on how genetically based it is, how stubborn it is, and so forth. Some people have to use medication because they don't want to become diabetic, and it's very embedded. Their lifestyle has to change significantly in order to reverse this, okay? Cortisol is a bad one. Lots of people are under stress. Now, I just want to kind of maybe clarify this. It's not that we have adrenal burnout or adrenal fatigue or, so forth. We have maladapted adrenal glands. So as we're going through stress, our stored cortisone turns into free cortisol, and the ability to go between the two will change based upon what you're doing in the health of the adrenal glands. But a lot of times it gets maladapted with stress. Sometimes we can be pumping out a ton of cortisol, or we're not pumping out any at all. Really, when it's not in the sweet spot, cortisol will lock in the fat cells and it starts to mess with blood sugar and insulin. So cortisol has its own issue, and then it also impacts insulin and blood sugar. So you get a double whammy there. If you're stressed out and you have insulin resistance, now we have 2 things going against us that are barriers to what we're trying to do with laser-based fat loss, okay? A real big one is leptins. So let me give you the story on a leptin real quick. Here's a fat cell, and fat goes up to the brain. And it basically says, hey, look, there's a lot of us down here. So you're having a lot of leptins, and it goes up to the hypothalamus and it turns down your desire to eat. And as a result, you eat less. And so this is your fat cells curbing your appetite. But just like insulin tries to affect a cell and it becomes resistant. Your brain becomes resistant to leptins. So your insulin can go up and cause inflammation and lock in fat, and then leptins can go up and it locks in fat and it makes insulin resistance worse. So we measure leptins in our patients. So when the leptins are really high, we know they probably have insulin resistance. We also know they're very hungry. They're more prone for binge eating. And the other thing that's interesting is when leptins go up, they end up going into your joints. And when it goes into your joints, it starts to make them hurt and become inflamed. So you can now see insulin resistance, gaining weight, joints breaking down, gut starts to get bad, you start to get brain fog, and there's a lot of inflammation going on. And as you start to, visualize these patients, you can start to recognize it and say, I wonder if their gut's healthy. This person looks like they might be insulin resistant. I bet they're not dealing with blood sugar well. We got to do some stuff with diet. Even though the FDA clearance on Emerald technology, we didn't alter diet and people still got better. But what can you do to make things even better and then also help the patient's overall health so they don't get diabetes and things like that? And then I'll show you also how using the laser has actually helped some of these conditions. So we'll get to that. Again, thyroid hormones are really big. I think this is kind of a no-brainer. Most people would really recognize that if you have hypothyroidism, you're going to gain water weight, you're going to gain, more fat. It's going to be much more sluggish digestion, and so forth. So, and then estrogen is a big one. I didn't put testosterone in there, but I am going to talk about estrogen in both men and women. If it's imbalanced, estrogen will affect cortisol, and estrogen will affect insulin. And all of that together will make this fat cell be locked in even more. So now 3 times locked in. So if you're going through menopause or you're postmenopausal, you have insulin resistance and you're under stress and you're not sleeping good and you're not hydrated, you're setting the stage for poor results. All right. So just understanding some of these basic things and making some basic changes, you can end up getting some really cool results. So this is fun. Cortisol, you'll see a lot of times lower belly fat accumulated. It's not so much out on the love handles. So when we start to get belly fat and then it moves out to the love handles, and then you start to get back fat right here. I'm sorry if I use the word fat, I'm not trying to offend anybody. It's just easier to say than adipose tissue. If you start to get fat now that's spread from just the belly, and now it's going out to the upper hips and lower back and mid back, that starts to look like insulin resistance, okay? And they may get a puffier face. They may get a puffier face with hypothyroidism as well. Now, if you take this and you expand it down, and now you see bigger hip distribution, or on a male, you start to see breast tissue that forms, now we're looking at estrogen dominance. So it's not as much back fat, but now it looks like a combination between cortisol and insulin resistance, but instead of it moving upwards on the back with insulin, it moves down over the hips and thighs, and these are your estrogen or hormonally imbalanced patients. Now, when I say estrogen, there's 3 types of estrogen. There's E1, E2, and E3, and there's a bunch of metabolites that discuss basically, are you metabolizing it or non-metabolizing it? So that's the limits of what I'm going to go through. I'm just basically going to say estrogen imbalance. Is it before menopause where you have estrogen dominance, or is it after where you maybe are having estrogen failure? There's a lot of things that go into that, but I just want you to be able to recognize that these are some of your hormonal distributions. And then look, there's a lot of times around the shoulders and the back of the arms, there's some problems as well. With thyroid, interestingly, is you get a lot of adipose tissue under the armpits and sometimes on the back of the triceps in this area. And always, always, always just look at the throat and make sure they don't have a goiter, okay? Some people just don't know if they have these conditions because they don't get good labs run on them, or they don't go see a family doctor, or they don't, you really have to realize that a lot of people are going to come to you, and when you start giving them advice, it may be the first advice that they've had in regards to their overall health in a long time. So some of the things that you pick up can not just help them lose fat and look better, but you might be finding conditions that need to be treated so they can live longer. And I think that's one of the messages that I'm trying to get across. You have great access to these individuals that come in because you see them quite often, you're talking to them. It's always good if you can learn enough to be able to help them just be healthier in general. All of you will find yourself on the spectrum of how much of this you do. I just want you to learn to do as much as you can over time. And some of you that have been doing this for a while, you may be seeing some of these same things. All right, so don't be scared of this slide. It looks a little bit crazy, but I'm going to go through it, okay? So here's regular grouping of fat cells, okay? Now, one of the things that's really interesting here is impaired angiogenesis. I want you to keep this in the back of your mind because red is a very cool thing here. So just keep that in the back of your mind real quick. But when you start getting a lot of inflammation and insulin resistance, you start getting macrophages, which really are immune cells. And so these macrophages, these these individual macrophages, they start to change, okay? You start to get M1 macrophages, they change with inflammation into M2 macrophages. And it basically puts this fibrinolinic or fibrous netting around the fat cells. Now that's interesting because it puts a barrier around them, but when fat content actually comes out, it makes it difficult to get to the lymphatic system to get out. So when you have inflammation or you have insulin resistance, or if you have any of the big five, it can make it to where you can get into this state. Okay, so instead of going over here where your leptins are now under control, your insulin's under control, and then there's something called adiponectin, which I'll talk about in a second, it's under control, everything looks great. But when you have inflammation, it makes insulin resistance. When you have insulin resistance, it makes inflammation. So food can make you inflamed, infections can make you inflamed, gut dysbiosis can make you inflamed. But if you're diabetic and it's not controlled, this process is going on. Leptins are going up and it's getting resistant and it's making your joints hurt and it's perpetuating the insulin resistance. Tumor necrosis factor and all your inflammatory cytokines are going up, so it can give people brain fog and start to break down joints and other tissues and things like that. So we want to stay away from this. And if you just have hyperplasia or too much of this, the laser comes in here and there's virtually no stopping it at that point. But when you have a bunch of other complications and you have this network and you have this very complicated thing going on, now it makes it to where the light is not as effective. So when you remove the barriers, you go to this state. All right. So here's fat cells. You have an M2. If you have inflammation, it now turns into an M1 macrophage, locks all these in, makes the adipopore not open, and now we get that network around here that starts to protect everything. And one thing I will tell you is violet helps break down the network and red helps with angiogenesis. So after we're done with an emerald session and we're doing our visceral massage and lymphatics, which I'll talk about in a second, we go ahead and go over them with a handheld violet and red laser to help break down this network and to change the flow of the lymphatics and blood to this area, which is very, very interesting, okay? Now, at the same time that we have leptins, and leptins can go up and insulin can go up, if this gets bad enough, adiponectin goes down. Now, adiponectin is what fat cells make to stop inflammation. And it's a big, big preventer. So when you have good adiponectin levels, it's good for heart disease, it's good for inflammatory bowel disorders, it's good for inflammatory brain disorders. But when you start to get leptin resistant and insulin resistant, and you start to get this mess over here on the left side of the screen, you now start getting these M1 macrophages instead of M2 macrophages. Inflammation goes up, and the adiponectin that stops that inflammation goes down, and it's a cyclical thing of inflammation, low adiponectin, inflammation, low adiponectin, and it goes round and round and round. And as the adiponectin goes down, insulin resistance goes up and leptin resistance goes up. And I try to put these references down here, so if anybody wants to read about this, then that's perfectly fine. This is referenced right out of this paper, okay? So again, inflammation, insulin resistance, leptin resistance changes the macrophages from M2 to M1, makes this network around there, makes it difficult to get fat to the lymphatic system and out. And ultimately, it ends up making our adiponectins go down. We get more inflammation, and it ultimately promotes disease, okay? Now, here's what's cool. We have found that as we do laser therapy on fat, when we do laser therapy on this and it does start to work, it's actually helping reduce insulin resistance and, abnormal insulin levels just from laser alone. We're seeing insulin resistance drop, leptin resistance drop, and inflammatory markers drop. So the laser helps it, but then the diet can help it, and sleep can help it, and hydration can help it. So when you put it all together, they're all working together as one. So it's really interesting that it seems like I'm talking about things that make the laser not work, but in reality, the laser is helping prevent and control a lot of those things, at least in our clinical setting. And we're also starting to see that in some of the research that's coming out. So it's really cool when you start to see this story and you look at this picture, it makes a little bit of sense. And then we know that when you have stress, I talked about cortisol a minute ago, we have, white fat and we have brown fat. And when we have stress, it just basically makes inflammation in your immune system become skewed a little bit. So when you have it, it just, again, makes these fat cells get bigger. It blocks the adipopore. It starts to make that network around it. It promotes insulin resistance. It promotes leptin resistance. So stress can now cause the insulin resistance. Stress can now cause the leptin resistance, and stress can now make you overeat, and stress starts to accumulate fat right around the umbilicus or the belly of somebody. If that gets worse and become insulin resistant, now it goes from the belly to the sides. And if it gets worse, it goes up to the back. And if you get more stress and you start having hormone fluctuations, now it starts to go down over the thighs. So you need to learn to look at these patients, and sometimes you can see these patterns. It's pretty cool. So stress just basically does this. Cortisol makes it to where the fat cells, I just call it locking in. It's not that it won't come out, it just makes it more stubborn, okay? Here's your leptins, and I was talking about this, and leptins, again, they come from fat cells, they go up to the brain, and they say, quit eating, but you get resistance. And when that happens, you get insulin resistance. That causes inflammation. Inflammation further locks things in. It also starts to break down other tissue. You get oxidative stress in cells all over your body and in your brain and in your liver and in your organs. So a big deal is to keep insulin down under control. We don't want it to be so low that it looks like type 1 diabetes, and we want leptins to be down as well. You can measure these two things pretty easily, and you can see your progress. A lot of times we'll measure these markers and we can see that the laser, what we're getting in regards to circumference measurement and body fat content, it responds significantly different as we start to control all of these markers, okay? So we can measure these sometimes at the beginning and say, instead of 8 sessions, it's gonna take you 14 sessions. And we've kind of gotten good at gauging it because it takes us time to control some of the other factors. It may just take longer or more sessions sometimes when somebody has a lot of underlying metabolic issues that are kind of screwing with things. So a lot of people will come in and they're like, look, I'm getting bigger and I'm getting hungrier. That's leptins. A lot of people will say, I'm craving sugar, I'm not sleeping well, and I'm getting bigger. That's insulin resistance. A lot of people will say, I'm stressed out and I'm eating more. That's cortisol. So I'm just trying to give you little bitty, little ways to go through this to where you can just make sense out of it sometimes without having to go through a giant, lab protocol, but that is still sometimes nice to use the biomarkers if you can. Thyroid is basically the mother of all of this stuff. If you have hypothyroidism and it's not treated, I'm telling you, things are not going to work. It's going to do all kinds of things. It's going to actually affect your liver, and you're not going to detox the right way, which is going to create something called hepcidin, which creates inflammation, and that's going to set in motion insulin resistance, okay? If you have hypothyroidism, it's going to cause all kinds of lipid problems, and it's going to screw with your vasculature. It can actually cause heart disease, okay? The other thing is it's going to make to where you expand, those fat cells are going to expand and get bigger and get locked in, and then it promotes insulin resistance, which locks it in more, and then it changes the flux of fatty acids, which can change those macrophages into more of a fat containing macrophage than a fat releasing macrophage, okay? And then ultimately, thyroid problems is going to cause all kinds of damage to the immune system if it's not correct, and it's going to create a lot of oxidative stress, which means the cells are going to be damaged all throughout the body. So this is truly progression of disease and bad health. So we have insulin, we have leptins, we have cortisol, and now we have thyroid. And so again, there's a lot of things we could talk about in regards to the thyroid, but if your TSH is going up and your free T3 is going down, the patient needs to be dealt with appropriately. Sometimes that's medication, sometimes it's nutrition, sometimes it's other things, but they need to see somebody that's skilled in regards to looking at their thyroid. And sometimes I'll do some dietary stuff and make sure their thyroid gets managed and then start them on Emerald type therapy because I know I'm going to get better results if I can control the thyroid disease. It has to be managed if you really want to get the best results. This is insulin resistance and estrogen deficiency. It kind of got cut off here, sorry about that. But if you have estrogen deficiency, or you have estrogen imbalance, or if estrogen is not being metabolized the right way, it immediately causes insulin resistance. It immediately causes adipose tissue to get bigger and you become inflamed. It again messes with the liver, which causes inflammation, which has an impact on fat. It actually makes it to where your muscles become fatigued. There's a reduction of glucose uptake. So you see these people, they're not as athletic. And a lot of times they, start getting sarcopenia, or their muscles will start to change in regards to the overall muscle volume, the muscle tone, and the muscle size. And then it can mess with just insulin production from the pancreas as well. And if I say insulin one more time, it'll be 1,000, but I'm just telling you this right here is a big, big, big one on this. I mean, if I'm giving you anything, at least learn that. And people get insulin resistance from genes and what they eat. If they eat a lot of, carbohydrates, a lot of grains, very low protein diet with very low exercise, they're going to eventually become insulin resistant or diabetic if they have the genes for it, okay? You see some people, they can eat whatever they want, it doesn't affect them, but 45% of the population is going to have an insulin resistant gene. All it takes is the right environment and it triggers it. And if you don't understand it, it's going to make it more difficult for you to utilize the tools that you have, such as Emerald technology or other types of green light for different devices from Erchonia. Okay, so a lack of sleep. I told you it can cause hormone imbalance. So when you're talking to people, make sure that you know if they have sleep deprivation. Make sure if they're hungry at night, that's leptin resistance. If they're getting up in the middle of the night and eating, sometimes it means their insulin is so high that their blood sugar is dropping in the middle of the night and it's waking them up. So ask them about their sleep. You can learn a ton about a lot of things, okay? So here's these leptins, and of course, whenever you have this lack of sleep and you get leptin problems, it makes you crave things. I just talked about that over here. Leptin going up, hormone imbalances and low sleep slows metabolism down. You certainly don't want this on top of hypothyroidism. It's just a really bad thing. And people who don't sleep well, they have less physical activity because they're tired the next day. So they really don't want to get out and exercise and do the things that you want them to do. I will tell you, you always should be talking to patients about moving. They should at least be taking a walk, during the day and getting their heart rate up and stuff like that. If they're not doing that, then it's just too sedentary. It's hard to expect a lot of things. So some of the nutrients, vitamin D, it's been linked to weight gain, obesity. I like their vitamin D to be at least 70 or above, but I don't like it. Whoops. Sorry about that, folks. I don't like their vitamin D to be above 100 to 110. I like to be, and I like it to be above 70. So between 70 and 100 is where I like it, okay? And men have a much more difficult time at typically getting their vitamin D levels up. So there's different doses that you can give people and stuff like that. A lot of times 2,500 units is not too much. Some people I'll take up to 10,000 international units. Magnesium deficiency. Not magnesium citrate, but magnesium threonate, magnesium glycinate. All of these things, along with berberine, will help regulate glucose and insulin. So I'm just giving you a few nutrients that you can use. You can use a magnesium berberine combination, and a lot of times it makes a big difference. If you're going to use berberine, get this. There's newer versions out that is a very small molecular weight, so it gets into various cells much easier. Okay. If somebody has iron deficiency, it's going to cause fatigue and they're not going to want to exercise. They cannot be anemic and they cannot have iron deficiency. Be careful in your older populations. If women are menstruating very heavily, their estrogen may be off or their hormones may be imbalanced, but they may be bleeding out a lot of their iron and they get significantly fatigued. Their metabolism goes down and they cannot lose the fat that they're wanting to lose. So please make sure that they don't have iron deficiency anemia. I'm just throwing that out there as a basic one. Vitamin D and iron deficiency are two things that a lot of people have. They don't know it because, again, they haven't been to see a doctor that looks at this stuff in a long time. We're seeing a real problem with that right now. Zinc deficiency is super common. Interestingly enough, zinc is involved in the appetite regulation. And when you have low zinc, it really, you won't metabolize carbohydrates well, and it makes your insulin go up. And so you get insulin resistance. That's the metabolic syndrome. That's the inflammation. It locks fat in the fat cells. And so we use zinc sometimes along with carnitine and balanced iron and vitamin D and magnesium as just some basic things to make sure that somebody's metabolically stable enough to do this. And then really vitamin deficiencies are a big one. B vitamins are really essential for appropriate adrenal function and cortisol function, but they also help stabilize blood sugar and it helps control insulin regulation as well. But you're also can be very fatigued and very, very tired. So I'm going to teach you a real quick trick here. When B vitamins go down, you can get anemia. When iron goes down, you can get anemia. However, with iron deficiency, the MCV, the volume, the mean corpuscular volume of the cell. In other words, with B vitamin deficiency, the cells will get very big, the red blood cells. With iron deficiency, they'll get really small. So if you think somebody has anemia and their cells are getting smaller, you can think iron. Not always, but most of the time. If they're getting anemic and their hemoglobin's coming down and their cells are getting bigger, you can think B vitamins. And I give a combination of methylation and hydroxylation because you can't always just give methylation. It will make people anxious. To counteract that, you give the hydroxylation. So I give a hydroxylated and a methylated to cover most people, okay? So this is it. Look at my insulin, look at my leptins, look at my cortisol, look at my estrogen, look at my thyroid. How's my vitamin D? How's my iron? How's my magnesium doing? Do I have zinc deficiency? And then do I need to give methylated or hydroxylated B vitamins? Are they sleeping good? Are they staying hydrated? And are they getting a little bit of exercise? Those are some big things that go a long, long way, okay? A long way. And I really wanted to just give some of the basic things during a short time period. Some of these things you can utilize really quickly without having to get really too complicated, okay? So as we start kind of rounding down towards the end, it's important if anybody does want to do labs, if you do some of these labs right here, you can make a tremendous difference and measure it. We can measure leptins and see, are they going to be hungry? Are their joints going to hurt? Is it going to trigger insulin resistance? We can measure insulin, and then C-peptide is another way to measure insulin. C-peptide will go up and free insulin will go up and leptins will go up, and it's a very hungry, sugar craving individual that has fat around the stomach, love handles, and up the back. We see it all the time. You can just see the pattern when you're kind of assessing them, maybe with their shirt off or something like that. I do run a thyroid panel. I don't trust a lot of the other providers. Sometimes people will just run a TSH, and you can miss hypothyroidism if you only look at TSH. Sometimes T3 will be down, but your TSH will be stable. There's 24 different patterns of hypothyroidism or thyroid disease. We're not going to get into all those, but nonetheless, just looking at this pattern and saying your thyroid is really sluggish, we need to fix that, and then you can get into more, you can do laser. I'll actually laser their thyroid with other modalities or different things with red and violet and make it healthier. And if they need medication and so forth, that can be managed. But then we get them into the point to where they respond to green light and fat loss much better. We look at cortisol. I look at it 4 times a day: morning, lunch, afternoon, and evening. And a lot of times you'll see the cortisol, it's way high and then comes down, or it's really low and then spikes up in the evening. There's all kinds of weird different patterns of maladaptation that your adrenal glands can go through. But if they have it, just be careful. It's going to change what you're going to see, okay? Sex hormone panel, big one. Obviously, your estradiol, that's E2. It's part of the 3 estrogens, E1, E2, and E3. But looking at your estrogen, and of course, if your hormones are imbalanced, it's going to cause everything from inflammation, insulin resistance, water retention, which is very frustrating when you're using Emerald or you're using green light. It's very, very frustrating when they have water retention, because if you're measuring them on a day where they have some water retention because of inflammation and hormone fluctuations, they may actually gain an inch, and then later on they will diurese a lot of that fluid off, and then they lose 3 inches, and so you're not catching them at the right time. A lot of times we just use DHEA. If the adrenals are kind of struggling, your DHEA can shunt into your estrogens and testosterones. So a lot of times when you have adrenal stress, you can use DHEA to help your adrenals, and that will also help with sex hormones, especially if they're a little bit deficient. I put in some inflammatory markers in here because if you have inflammation, you're going to lock water in and it's going to be difficult. It's going to lock fat cells in and you're going to have a difficult time getting an adipopore. So you can measure tumor necrosis factor, interleukin-6, and CRP is a big one as well. Sometimes also your stored iron or your ferritin will go up as well, and that's a sign. If it's not iron storage disease, then it's inflammation, okay? Obviously, glucose and A1C, if they're diabetic, you have to talk to them. It's going to be an insulin issue, and that has to be managed along with this, okay? Really, on a lot of my insulin resistant and diabetic patients, we just do more, we do more emerald-based therapy, and it actually starts to help that disease and that condition a little bit, especially along with their medication if they need it and some of the supplementation as well. It just takes a little bit longer, but we have to explain it to them up front. Look, you have these biomarkers that are abnormal, so you need to expect this instead of a shorter, protocol. I look at lipids just because I like to look at heart stuff, and we do a lot of laser stuff for heart health and so forth. But remember, your adiponectins, if they are going down, that means you're inflamed, your leptins are going up, and you're getting insulin resistance. Adiponectins are what your fat uses to protect from the inflammation that it may or may not be causing. So again, you can run this really simple through labs. Everybody should really have a vitamin D. It's not just about sun. There's a lot of genetic components that go into. There's a gene for, does vitamin D convert in your skin? Does it actually dock on the receptor? Is the receptor actually healthy? So there's a lot that goes into that, but nonetheless, with suboptimal vitamin D, you can expect some poor results sometime. Again, same thing with magnesium, vitamin B12, folate, and the things that we talked about just a minute ago, and iron and stuff like that. So I run just a simple blood count to see if they're, a CBC to see if they have anemia. And I look at their CMP to look at their liver to see if it's healthy and stuff like that. And I want to see if their kidneys are doing good. And I do run an iron panel because I want to make sure that they're not getting iron deficiency anemia. So if I look at all these things, I can make a diet for them. I can make lifestyle changes for them. I can make an exercise protocol for them. I can determine, do you need 8 sessions? Do you need 12 sessions? Do you need 16 sessions of laser-based therapy? And then what are we going to expect? And this is just one of those things where it helps us put together a protocol that's just going to work for the person and it's going to be realistic for them. And then really last but not least here is your gut health. People that have, you should always ask, do you have bloating? Do you have diarrhea? Do you have nausea? Do you have, any kind of stomach pain, and find out what quadrant it's over. But if they have gut dysbiosis, their akkermansia a lot of times will drop. This causes SIBO. And then you can see a strain of lactobacillus, another strain of lactobacillus, and bifidobacter. This one in particular, just giving it to people that have obesity has made tremendous, changes in a lot of patients that have gut dysbiosis. In fact, some people, you just change their microbiome a little bit with various products that have this in it, and they start losing weight without anything else. So if you want to do anything that's going to help your patients, you can support a microbiome that has properties of having a population that defeats fat versus promoting inflammation. You will make huge changes in that person's health. Not only that, they'll have less inflammatory brain issues, inflammatory cardiac issues, inflammatory liver issues, inflammatory renal or kidney issues. We have started doing a lot of stuff with the microbiome and insulin and having 25% increase in regards to helping those that were just very, very stubborn and aren't losing well. In fact, sometimes just going to the gut and the microbiome makes all the difference in the world. You can measure these on certain tests, but you can also just give you can look these up on the internet and you can find various products. Some just may have one strain in it, some may have several strains in it, but it does make a good difference, or a big difference, if it's a good quality product, okay? So again, very, very interesting. Never underestimate what akkermansia. It's very expensive, but it's also, if it's low, it's very, very beneficial for somebody. It takes them away from an inflammatory state and makes them into a state where they're going to break down fat and they're going to actually allow their contents to come out. The one thing I will say is if somebody's losing weight really quickly, or they're losing fat very quickly from Emerald technology or green therapy from Erchonia, a lot of times they'll dump the contents of the fat cell out, and they'll start getting a little bit of they'll feel kind of sometimes they'll feel a little lousy because they are dumping toxins into their system. Sometimes some bentonite clay or some, some charcoal or some fulvic, some types of different binders. You can use binders and it will make a difference in these patients and it will help bind those toxins. Those are also the people that need more lymphatic massage in order to get some of that stuff out. And if you don't hydrate those people, they won't feel good. In fact, if people don't stay hydrated at all, that is just the one thing. That and sleep are two things that will completely defeat this whole thing. Some people are so dehydrated, we've had to give them IVs in order to hydrate them. So yes, you can vibrate them, but if they have a lot of mesh or a lot of that fibrotic tissue around the fat cells, you have to get deeper in there. We use a percussor in red and violet to break that down, bring blood to it, open up the lymphatic channels, and all of the green light that allowed the contents to come out, we use red, violet, and a percussor and lymphatic massage to break down those adhesions, break down the loculation around the fat cells so the triglycerides can get away and they can go to the lymphatic system and it works. So there's a lot of different techniques out there that people are developing, but we've learned to use red and violet along with green to perpetuate this. At least we have in our facility. I'm not saying that that's something that Erchonia necessarily endorses, but in our clinic, what we've done is we've started utilizing every wavelength to our advantage. And I think that's really a big deal. We've even started doing some of it over thyroid and over brain and stuff like that in order to help those areas function better so that, we're seeing better results. Sometimes over the gut, we also do it as well. There's all kinds of cool things, but learning how to do lymphatic massage or lymphatic drainage techniques or having a lymphatic modality, some people use vibe plates and then they do lymphatic massage and everything, but they're trying to get the triglyceride away from that, or that dumped content away from the adipocyte so that it doesn't reabsorb within 48 to 72 hours. All kinds of fun things that you can do, but once you learn to look at the patient and you learn to figure these things out, and if you do any biomarkers, you can start saying it's not going to respond in this many treatments, we're going to need this, or it's going to respond very quickly, and you'll really learn how to kind of walk your way through it. So when I put it all together and I do this, I do body observation and I go through, does it look like cortisol in the belly? Has it moved around the sides with insulin? Has it gone up the back or down the legs or behind the arms or under the armpits? And then we measure biometrics. I don't measure circumference. We use a laser-based device that takes sort of an image of the body and it measures everything and it shows their body fat content to lean muscle content and so forth. And it will tell us the total amount of inches so we don't actually have to measure. And if you're going to, use some of this and do it and really try to show patients outcomes, sometimes that's a good thing to have. We always do a dietary consult. I have a health coach that looks at every patient. Now, this is just our practice. I'm not saying you have to do this, but some people don't understand that the way they're eating is just defeating. It's a defeating purpose. It's going to make them unhealthy, and it's also going to make it more difficult for you to get the results that you're wanting, okay? Please look at medications. Just in general, if somebody's, and I'll just tell you this, if somebody's taking psych medications or even antidepressants, it is going to lower it's going to make it much more difficult. All of those things promote insulin resistance and weight gain. So it's very difficult to fight the fight against a medication. Always look at the medications and then just simply go to Google, or you can even go to ChatGPT. You can just say, does this medication promote weight gain? Or does it make it more difficult to lose fat? And you'll be shocked at the amount of medications that you didn't even ask about that are defeating what you're trying to do. Ask about that GI health. Remember, I talked about the probiotics. I love the labs. You may not. That's why I talked about just learning how to kind of eye the patient a little bit, okay? If they're dehydrated and if they're not staying hydrated, this is very, very difficult to do. And with hydration, I always give an electrolyte blend so that I don't dilute their electrolytes with giving them too much water and then create a potassium or a sodium issue. That's a whole different medical issue. You don't want to hydrate somebody and then all of a sudden their electrolytes become skewed because you diluted them. Binders, I told you about that. Sometimes that's a big deal. Sometimes just binders alone kicks on the process and they start doing better. I told you about some supplements, things like berberine and carnitine and vanadium to help with insulin resistance, adaptogenic herbs to help with adrenals, selenium, iodine, magnesium, CoQ10 to help with your thyroid. There's some basic nutrients. Make sure your vitamin D is good. Make sure that you don't have B vitamin deficiency anemia or iron deficiency anemia. I just measure those anyway even if they don't have anemia, because it takes a while to be deficient in those to actually get anemia. But I support B vitamins a lot. It increases metabolism and it helps people function better. Lymphatic soft tissue mobilization. I told you sometimes I use red and violet after we do a green session. And as we're doing the lymphatics, we'll actually use a handheld red violet over that, like an EVRL, and go over this because it breaks down those channels that are around fat. It increases lymphatics and it changes the blood flow in and out of the area. We plan our sessions. Like you may need 8, you may need 12, you may need 16. I'm just telling you, we have different sort of packages based upon what their underlying profile looks like. And I measure them in intervals to make sure that on session 4, we remeasure everything. And if I have to adjust at that point in time, I will. And sometimes that adjustment makes all the difference in the world. They have to exercise. And I have somebody that knows all of this that is coaching them and answering questions. This is a big deal. This is called keeping your patient, let's see if I can do it here, happy. Okay, if they know they have communication with you and they know that you're trying and that you're doing everything you can to answer questions and not just coming in and leaving and they never see anybody, they know that you're working for them. I'm telling you, it's practice management, it's practice building, and it also builds relationships and stuff like that. Okay, peptides and all these other things, I'm not going to talk about them. I think the laser and the things that I just talked about work really well. Some people will add peptides because they don't want to address those other things and they just want to get quick results. We try to stay away from those things, but there's obviously an interest in these things. So going through all of this right here and then making a plan that, and then what we do is once they get done with 8, 12, or 16, we just allow them, we'll let them pay for a year and then they can come once or twice a month for a set fee. And that way we keep that patient and they continue to see results and we continue to be involved in their health and they continue to see the health coach and we continue to keep our patients. They think that we, they understand we care about their health. And so you have a referral network that way. If you want to build this without having to spend tons of money on marketing, you build it into your patients and you make them happy. And then they are basically the best marketers for you. So there's the 5 factors. I gave you a lot of stuff, but I tried not to douse you with a ton of things. I gave you this to really sort of make you start thinking about some of the things that you might be seeing. If you're new to this, you'll start seeing it. If you've been doing it for a while, maybe this explains some of the things that you've seen. If you've been looking at these other markers and everything, you may already understand what I'm talking about. So this really addresses everybody along the spectrum that's trying to utilize these devices in order to make people look and feel better. So I think my time is up. It's been fantastic. I've gotten to spend time with you today. Remember, understand your patient, know what they're going through, know their history, put it all together, utilize these fantastic devices that we have that have been scientifically proven, and you're going to get results. Thank you very much.
Thank you very much, Dr. Brandenbroek. I've only got one question. Any advice when targeting visceral fat versus subcutaneous fat?
Yeah, well, it does work on both subcutaneous white and brown fat. It works on both. Some of the, I will just say this real quick, and this is something you guys can kind of just take as kind of a clue or a hint. Some of the, especially men that come in that have larger distended bellies and they look obese, but you feel their fat and it's really, really hard. If you do your initial treatment and they don't drop like a half an inch, quarter an inch, or an inch or whatever, and they just keep it, it's going to be more difficult to get to that brown fat. It takes more time, and they're almost always assuredly having some sort of like detoxification issue or insulin resistance for sure. They start getting a lot of deep visceral fat and organ fat. And then women, of course, get gynoid fat with estrogen, and that's packed around the hips and so forth. So it just takes more time. It's going to be more stubborn. A lot of times when you do that first trial, if they don't lose that, you can sit them down and talk to them. You can make a plan sometimes where it's once a week and it's spread out rather than twice a week. We found some success in some of that. Sometimes, the more you do in a week doesn't necessarily equal greater results. In some of our patients, we actually see once a week works great.
Great. Got one question. One of our attendees is asking, probably I think is new to our technology. What are the contraindications for the green light therapy? So we know that, but I'm going to leave that for you to answer.
Well, I mean, don't shine over somebody's eyes. Don't shy.
Exclusions.
Yeah, I mean, try to stay away from a fetus, try to stay away from active tumors and stuff like that. There's really not a lot of contraindications, to be real honest with you. One of the reasons why is the milliwatts is very low, but the electron volts is very high, so we don't have to worry about burns, and we don't have to worry about overdosing joules per centimeter squared and exceeding the hormetic threshold. When you're looking at Newtonian physics, you don't exceed the the threshold, and so as a result, there's not a lot of contraindications in regards to tissue damage.
Yeah, great. What do you suggest for estrogen metabolism?
Calcium D-glucarate, diindole methane, maca. There's a lot of things that are already blended together that help with estrogen dominance, and it helps with the 4, 2, and 16 hydroxylase and pathways and so forth to help get that estrogen out. A lot of people become estrogen dominant, and it's just as bad for fat loss as somebody that is estrogen deficient.
I've got a question. Again, do you have any experience with BMI over 40? I guess this attendee is asking, do we treat patients like extremely obese patients? There shouldn't be a problem in this case. It's completely safe.
Are you saying a BMI over 40?
Over 40. Yeah.
Yeah, I mean, it's just one of those things where they just have more to get rid of. So you can't expect them to have the same results as somebody that has a BMI of that's 10 points less than that. But sometimes I'll just say, look, we're going to do a session here, and then we're going to give you a break and then do another session. So I'll kind of pulse it. Sometimes the people over 40 and that have a lot of bad lab markers, those are some of the people that we may start initiating peptide treatment on in conjunction with it. And it's not because the laser can't do it, but we know that they have a greater metabolic issue. So sometimes we have to use greater metabolic regulation. And I think that sometimes that's when we start getting a little trickier with some of the stuff that we add into it.
Great. So I think that's all for today. We have no further questions. Thank you, Dr. Brandon, for hosting this webinar, and to everyone who have attended. Recording will be sent out to all the attendees automatically, and if you have any further questions, please let us know. Have a great evening, and thank you for tuning in. Bye-bye.
Thank you.